Good afternoon, dear patients. Today we will discuss a case of erosion in the inguinal fold in a man. A man came to us who had an erosion discovered between his testicle and his thigh, specifically on the inner side of the thigh, right in the inguinal fold. He actually noticed it while showering, washing himself. It was slightly painful, which caught his attention. Considering that he had recently had sexual contact with a sex worker, although he used a condom, he was naturally frightened by this. After he realized what an erosion or ulcer was, he became worried about herpes, syphilis, and other diseases. Accordingly, he consulted our doctor. What was done? First of all, tests were taken from the surface of the ulcer, from the surface of the genitals, and from inside the urethra for sexually transmitted infections. It should be mentioned that the patient's oral cavity was not involved, so there was no need for similar swabs. The contact happened recently, literally a week ago. Medical professionals carefully collected cultures for bacteria by swabbing the surface of the ulcer to identify any potential pathogens. Regarding the process of receiving and reviewing the laboratory results, we have several updates to provide. First and foremost, it is important to note that all of the comprehensive tests conducted for various sexually transmitted infections have officially come back with negative results. Streptococcus grew from the surface of the erosion. What is that? This is Streptococcus pyogenes. In the inguinal fold, there is increased moisture, increased friction, a higher number of bacteria, and diaper rash often develops, which becomes infected. The skin becomes macerated, the skin bonds weaken, and on top of that, Streptococcus invades. As a result, a small blister forms, which, when it ruptures, creates an erosion like this. The patient was prescribed antibacterial ointments, which led to recovery. For the patient, the most important thing was to rule out sexually transmitted infections. Indeed, erosions and ulcers can also be caused by herpes, syphilis, and other infections. Therefore, in this case, when any kind of rash appears, the most important thing is to get tests done, including from the surface of the rash itself, which is exactly what was done for this patient. So whenever any rash appears in the genital area, groin folds, and so on, it is absolutely essential to get tested, and under no circumstances should you try to heal such erosions or ulcers on your own, hoping that there are no sexually transmitted infections, as this can lead to spreading them, including to your loved ones.